Good morning and welcome to the first day of Nurses Week. This is such an exciting time for nurse professionals across the globe. It's a time of recognition, but you and I know that every day should be a day of recognition. Every day and in every way, nurses provide care for patients in all clinical settings that require them to be at their best, to be the best that they very can be, and to really deliver on the promise of value-based care. That's what makes us number one in the Gallup polls each and every year. And that's what we'll be talking about today as we address compassion fatigue. I'd like to welcome you to the Nurses Week series. I'm Sharon Weinstein, and the sessions this week are compassion fatigue, life is a balancing act, stress and crisis management, and self-care is not selfish. We did have one change in the program, and I'd like to share that with you before I share my slides, and that is that Sunday's program, originally planned for Mother's Day, has been postponed to Monday at exactly the same time. That gives each of you an opportunity to share Mother's Day with those near and dear to you, whether it's via FaceTime or a phone call or an actual face-to-face visit. Perhaps you've already been immunized and you're ready to do that. So if so, I'd like to be sure to welcome you to that particular session on stress and crisis management on Monday the 10th. Let's get started. Again, welcome to Nurses Week. It's really a pleasure to be with each of you this morning. I hope that you're having a fantastic day. So again, we'll be talking about compassion fatigue, life is a balancing act, stress and crisis management, and self-care is not selfish. We have a playbook, and the playbook has been added to the chat box. Be sure to use that box and comment to me or to others within the program. It's a step-by-step guide to 4 days of content and photos and tips and lots of techniques for self-care, which we all need right now. Again, I'm Sharon Weinstein, and I welcome your connections. I'm a founder of the Global Education Development Institute, an author and a certified speaking professional. Is it really possible to have what people refer to as work-life balance or work-life integration? Is it something that perhaps you had in the past and have no idea how to reclaim now and in the future? Or is it life as usual? How do we define that? How do we make it happen in this year of the nurse and midwife and beyond? So whether your workplace is in a sparsely populated office, maybe a home office, or the kitchen island, make it your own. If you're sharing space with other family members, keep things in order and schedule downtime. Go for a walk, have a drink of water, stretch break, close your eyes for a moment just to refocus. Organize your materials at the end of the day and make it a reasonable hour. Not late at night, not back to the desk after dinner. Make it a reasonable hour and be prepared for the following day. Begin anew, begin refreshed, and somewhat balanced. And I suggest that you consider the power of 3. You see that one of my fingers has a smiley face. Think about what you need to do right now, today, in this moment, and then consider, will it matter in 3 minutes? This is not something that is a life emergency. This is not a critical issue within the healthcare system where someone may pass or have a negative outcome as a result of what you do. This is in your life and in general. So will it matter in 3 minutes? Will it matter in 3 days? Will it matter in 3 weeks or more? If it's not going to matter right away, if it's not acute, put it aside. Please, please put it aside. So I advise in every situation, no matter what it is, to take your temp. Temp in this case stands for thoughts, energy, mood, and perspective. And this concept was shared with me by a hospital client. So before every encounter in your personal, public, perhaps professional life, take your temp, mind-body connection. The mind and the body are connected. We all know that. We're nurses. And when one experiences disruption, they both experience disruption. Take care of your mind and your body through stress-busting techniques like meditation and deep breathing and relaxation and journaling and hydration and so much more, even napping. We'll be addressing what you can do to be the best version of you later on. We're all familiar with the stress cycle, aren't we? We know that there are 3 phases: the alarm phase, when we react to that stressor; the resistance phase, when we adapt to it or attempt to push back; and the exhaustion phase, when we know that our ability to resist is totally reduced and we feel as if we cannot do more. Not now, not ever. So what are the contributing factors to stress in our environment today? Well, first of all, workload, lack of PPE, commuting times to and from work, the inability to use perhaps public transportation and depending on other means to get where you need to be, transmission or fear thereof, vaccines or lack thereof. All of these are contributing factors. All of these impair our ability, yours and mine and our coworkers around the country and across the globe, impair their ability to survive and to thrive. Think about what works for you. We're all individuals, and what works for one of my colleagues might not work for me. But do you know how to relax? Do you focus intently on anything that relaxes you? Whether it's a stress ball, whether it's looking at a picture of a family member, do you take time to focus on deep breathing? Do you ever visualize a relaxing scene? What will you see? What will you hear? What will you feel and smell? And do you ever take time for a nap? Yesterday, my granddaughter, who is almost 10 years old this week, as a matter of fact, asked about a vision board that I had created years ago. She knew that I became a grandmother by pasting a picture, just a silhouette, of a baby on top of her mom and dad's wedding picture. And lo and behold, maybe less than a year and a half later, I became a grandma. She wanted to know, because she's the only granddaughter in the family, what I did on a vision board to create her. She already knows that she's the icing on my cake, that she's the apple of my eye, and that she brings me wonderful joy. But she wanted to know what worked for me that made her being possible. Think about what works for you. What is the power of self-care? Self-care allows you to value you, only you, to honor, nurture, love, and respect yourself. It is at the core of all that we do, not just in the healthcare service, but in every type of industry. It's at the core of successful living. Taking time for self-care has a positive impact on our quality of life and empowers you to reach your goals. You need to be your own cheerleader, and here's how you do that. First of all, put self-care first and foremost. Take responsibility for yourself. Allow yourself to live in a healing environment where you have time to take a nap, where you have quiet time, where you have downtime, and read and interpret the signals from your body that say, hey, I'm tired. Please give me a break. What about your mindset? When you think negatively, you can expect the worst. Woe is me. Negative thinking is thinking about, if I win that prize, if I get accepted to the university, if I get that job promotion. Don't think that way, because that's what you'll attract into your life. Instead, think positive thoughts. Have that glass be half full and not half empty. Expect the best and focus on a successful outcome. When I get the prize, when I win that grant, when my RFP is accepted, when I'm accepted to the graduate program, when I get that job promotion, when I get to go on vacation and perhaps go without a mask. That is the result that you'll get most of the time. It's all in your mind and you control it. You control it with determination. A success mindset strengthens your determination. Without a success mindset, one failure is usually enough to convince you that pursuing your goals is simply a waste of time. Do you think that those goals that you set are simply a waste of time? Or do you want to see them evolve into successful solutions that perhaps change your life and maybe even change the world? So what questions do you have? You can send those questions to me at one of the email addresses above, or just simply reach out to me. Be sure to visit my website and be sure to connect. Let me know if you have questions specific, and we'll look in the chat room to see some of those. So in the chat, I see that Susan, who is from Austin, Texas, has a question with respect to what can she do when she's a single parent with 3 kids, a full-time job, and a full plate. Even with all of those parameters within that setting, you can, in fact, Susan, take time just for you. Make it time after you put your kids to bed. Take 10 or 15 minutes to do deep breathing, to journal what you've done all day, to relax, to hydrate. If it's early in the morning and you can't leave young kids because they can't stay alone and you need to exercise, do simple stretching, practice yoga, practice meditation, practice deep breathing, and do what matters to you. I hope that that helps. We also have a question from Karina, and she hasn't given her location, but her question really deals with the concept of saying no. Is it okay to say no? And the answer is yes. We can't say yes to everything, folks. At some point, we have to say no, but we have to say no and not make an excuse. Gee, I'm sorry I can't help you. My grandmother died. Well, how many times can the same grandparent pass away? Eventually, people are going to catch on to the fact that you just don't want to do it. So if you don't have time to do it, and you can't see in the future having time to do it, feel free to say no. I wish I could help, but I just can't fit it into my calendar right now. Maybe you'll call on me at some other time. Perhaps you can even suggest someone else for that particular role.